It may be that we never find the source of particular outbreaks or clusters, but sometimes we get more information through further interviews and then identify that there's an epidemiological link between these. So these numbers may go down, but it is of concern to me, and I'll be monitoring these numbers through messages and calls I get through the night. If we need to put in place any other controls, then you'll be informed. And I say again that the most important thing we can do is actually get vaccinated and be fully vaccinated. As the Minister said, vaccination facilities are open, and within a couple of days, literally, we will have a vaccine for the 5 to 12-year-olds. That's really important. They tend not to be that unwell. The concern I still have is that in other jurisdictions, and I reported this yesterday, very significant numbers of a Delta cohort within the cases that they know about. And of course there's a lot of people who probably are infected but haven't had a test. So Territorians and those who've come here, please consider others when it comes to basic public health principles, and that is mask wearing, physically distancing, very important, hand hygiene, staying within your own group that you know, live with, work with, and people who you do not know, you might ask them to actually move away from you, even if they are wearing a mask. We want Territorians particularly to understand that these numbers are very concerning, and hence the information that you'll be given as soon as we know will be provided. Thank you.
Was there any questions?
So, Minister, if I could just ask you, we've seen a huge uptake in community transmission. I'm curious about two things with that. One is, what will be the threshold for a lockdown? The Chief Minister yesterday flagged that lockdowns are off the table, but lockouts will still be part of the health response potentially. And the second is, we're often told about cases under investigation and don't often hear about where they land in terms of if they're community transmission or not. So can we just get those two things addressed?
Yes, so the Chief Minister yesterday acknowledged that I think that we're past the point of lockdowns. I mean, we'll always take the advice of our Chief Health Officer and the officials. In terms of a lockout, though, we certainly have not ruled that out, recognising that those that are vaccinated are less of a threat in our community, and so you potentially could see that. So we'll take the health advice. As I said, we had that SEMSI meeting just finishing up this morning. We were fully briefed on everything, so we are in a concerning period, the case numbers and the community transmission, and we're watching that very closely, and we will continue to do so over the next 24 to 48 hours. In terms of the cases and under investigation, we find that balance, and I've spoken of this before, where we work to get as much information as quickly as possible so that we can understand the figures, and 115 can be read in very different, 117 can be read in very different ways. So we try and get an initial sweep of the information, but the contact tracing work does continue, and it can sometimes take 2 or 3 days, and then it is uploaded. All the states and territories provide information to the Commonwealth, and you'll see weekly case information. So we then come back and visit cases of concern that we feel the community needs to know about, but it's trying to find that balance between getting some information so that we can get that out to the community, but at the same time ensuring that we have enough detail to act upon.
Hospital currently have COVID?
Yeah, my understanding is that there's been 8 more staff members of Royal Darwin Hospital that have tested positive. It's not that they are catching COVID in the workplace, but more that they are return travellers, close contacts, potentially out and about in the community. So that is my understanding of the figure for today.